Dr. Clay Morton at Morton Chiropractic Clinic. Today we're going to show you what exactly is instrument adjusting. This is our instrument. It's called an arthrostim. It puts in 12 to 14 beats or impulses per second. So it uses this force to go in, but then pulls out. So the impact goes into the patient's body, but then pulls back up. And that makes the bone oscillate or vibrate. And then that triggers a bunch of neurology that helps the patient get better, get out of pain, decrease nerve irritation, all sorts of the positive effects that we do. So the impact can go from mere ounces all the way up to 40 pounds of impact. And we use different size tips, which make it very small and specific to make sure that we're getting the right impact at the right place of each individual bone. So this is what it sounds like. And then we put it on the patient in the correct place. And we go adjust the spine based on our analysis, making those corrections. We also use a type of percussion massage. We can change the speed to very slow for sensitive areas or certain types of tightness in muscles, or make it stronger. And then we work on relaxing the muscle tone in the area of complaint. We do not do manual adjusting. No crunching, cracking, twisting, popping. We do this because this becomes a lot more helpful to the patients who don't like manual adjusting or who have apprehension or they have a condition that shouldn't be manually adjusted. A fusion, spine hardware that needs to be precautiously managed, or a patient with osteoporosis and who has compression fractures. We can work above, higher than that area, lower than that area to make sure that we get change and correction, but do not put those other segments in a precarious position. We can also adjust babies a day old with very light pressure, or other patients with other different needs. We can also adjust with sitting on a stool or standing based on the patient's presentation.